Hello again. Welcome back to my channel, everyone. Good morning, good afternoon, good evening, depending on the case for you. It's great to have you back with me today, and I am going to talk today about healthcare again, in specific care of my health. But I really think this is going to be important for everybody because at some point, if you're not already dealing with health issues, at some point you will be, or you will know someone who is. And my raison d'etre, or however you pronounce that, is pretty much as you see in the top left corner of the screen. I'm sorry, top right corner of this, no, top left corner as you're looking at it. Advocate. It's a verb. And especially in the field of healthcare, it is very important for us to advocate for ourselves. And so I really hope that you will stick through this because I'm going to offer some tips and advice for everybody about advocating for yourself. Earlier in a couple of videos, I did a three video series on healthcare. One talking about my healthcare network, traditional healthcare network here in Madison, Wisconsin, UW Health. Although I have also been a patient in other traditional healthcare networks, and they are no different in how they operate. I also did a video segment from Dr. Mike. I would encourage you to watch that. And I did a video specifically about the Mayo Clinic network. And I encourage you to watch that video also. That was based on my experience at Mayo Clinic in 2020, and I again find myself now February of 2022 back in the hands of Mayo Clinic in Rochester, Minnesota, and I will make it plain why that is the right decision a little bit later on. So this is really about advocating for healthcare, and I will put it in personal terms, opening myself up because I think it's important to have real world descriptions, real world explanations. So in my experience at my healthcare network, when I go see a doctor about something unusual, something other than, a routine visit, or going to a specialist especially. When I look at the clinical notes, very commonly within the first 2 or 3 sentences of the physician's notes will make mention of the fact that I have a mental health history. Of course, I do have major depressive disorder, and I have PTSD, post-traumatic stress disorder, from being molested as a child. My MDD, my depression, is in full remission and has been since the discovery of ketamine infusions. And the PTSD I do still struggle with on occasion. But when you're going to a doctor for pain in your abdomen or a dog bite or back pain or a headache, those are not matters that should call into question a mental health history. And I think the only reason to do so is to be dismissive of the patient. I find that largely that's what happens, is that whatever my descriptions are jaded by the practitioner's knowledge of my medical history, and I don't know if they therefore believe me to be a hypochondriac. The attending physician at the ketamine clinic at UW Health, where I received most of my ketamine infusions, he is not my attending psychiatrist, but he does run the ketamine clinic, and he will occasionally note in the clinical notes B cluster or cluster B personality traits. And here's the thing about that, and I have discussed that at great length with a couple of psychiatrists, and the way they have put it to me is that all of our personalities are made up of traits, and some traits can be grouped together when they become a problem, and they become known or diagnosed as a personality disorder. And for instance, there would be a cluster B personality disorder, and that would be based on basically out of control personality traits from that cluster of traits, which may include things like rage or anger, histrionics, things like that. However, as this psychiatrist or these psychiatrists have put it, all personalities are made up of traits. And if you go to a medical school, or you go to a doctor's conference, or a nurse's conference, or anything like that, you're going to find all sorts of personality traits that, if they were a problem, would fall into one of those clusters. That doesn't mean that all those doctors have personality disorders. It means they have traits that are found in those disorders. That's all it means. But when the psychiatrist that runs the ketamine program specifically notes cluster B personality traits, other doctors see that and I think tend to jump to conclusions. And that's very unfair to the patient, because then they become dismissive of the patient. So, with that little bit of background, I, in early 2020, was dealing with a number of issues. And one of them was abdominal pain. And I saw my primary care physician, discussed the abdominal pain, this pulsing, throbbing, steady pain that extended from just below the sternum down to about the belly button. And he thought that that was gastroenterological, pardon my pronunciation. And so he referred me to the gastroenterology department. Doctor there did a video visit. This was in the days of COVID. I again described the pain to her as this pulsing, throbbing pain that started below the sternum and extended down to about the belly button, and that it followed the pulse in my carotid artery. And she said that that was GI pain, and ordered a colonoscopy and an EGD, which is where they go down into the stomach with a scope. And I said that I didn't think that it was GI pain. We knew at that time that I had an abdominal or aortic aneurysm, and given that the pain that I was having exactly followed the pulse in my neck, I didn't think that it was GI. And she insisted through the video visit that, in fact, it was GI. So I relented. I had the 2 procedures done, and of course, absolutely nothing was found. So that was early, probably May of 2020. So time goes by. Now, for about the past year and a half, I've been having pain that began in the very low right back, has crept around the entire side into the abdomen, up to the center line, and then down into my groin. And it has gotten intense, severely intense. To the point that for 3 nights in a row in December, I only saw one way of not having the pain, and it was not a good solution. I did go to the emergency room finally, and they did a CT scan of my abdomen, and found that my known aneurysm had increased somewhat in size, and that it was showing inflammation, as it had shown on CTs previously, inflammation. They palpated my abdomen. I had exactly the same pain that I had reported both to my primary care doctor and to the gastroenterologist back in May, I think, of 2020. I had exactly the same pain. The difference was this time I was examined by a vascular surgeon, a number of vascular surgeons, and they all said that was my aneurysm causing that pain, that it was symptomatic, obviously. They admitted me to the vascular unit, put me on strict blood pressure control, IV, to bring my blood pressure down to no higher than 120 systolic to reduce the risk of rupture of the aneurysm, and they prepared me for surgery on that Saturday to repair the aneurysm. When the doctor came in on that Saturday, she had operated on me previously due to a blocked artery that was missed for 4 years. And during that 4-year period, I lived on first Vicodin, and then oxycodone, and then oxycontin, and then Duragesic patches, fentanyl patches with oxycodone for breakthrough pain for over 4 years. I lived on that drug regimen. Finally, I was hospitalized for gastroenteritis. I read the CT report afterwards, saw that it talked about an obstruction of the iliac artery. I asked my primary care physician, could this be what's causing my leg pain? His response was, well, it says that there's some reconstitution of the artery, so it's not likely, but we should probably send you to a vascular surgeon just to have them take a look. The vascular surgeon immediately asked me, why have you never had a vascular workup before? I said, I can't answer that question. I'm not a doctor. And she said, you have classic claudication. You have a blockage of your iliac artery. They did an angioplasty, and in fact, my left iliac artery was 100% blocked. She explained that when you develop a blockage, your body will build little tiny micro vessels around the blockage to get some blood flow going, but it's not enough to support active use of the muscles. That's the reason I did not develop gangrene and lose my leg, was because the body had built these microvessels. But she said, this is classic claudication. You should have been in for a vascular workup long ago. Same surgeon came in December, and she said, I don't think your aneurysm is causing most of this pain, and if I operate on you, then if you need back surgery or something like that, you're not going to be able to have it while you're recovering for a few months. So I don't think we should do this surgery. I think your aneurysm is only at 5.1 centimeters. We don't typically operate until they're 5.5 centimeters. So I think we should just watch it for the next period of time. I'll see you in 6 months. We'll do an ultrasound to see what it looks like at that time, and try to resolve what's going on with your back. I discharged, had an MRI done of the back, which showed absolutely nothing surgical with the back, just a little arthritis. I went for a second opinion on the aneurysm out of my network over to Waukesha. He looked at the CTs on my record, including a CT of my carotid artery from March of 2020. And he said, well, you obviously have inflammation both in your carotid artery and in your aortic aneurysm in your abdomen, and you either have vasculitis or some kind of inflammatory disease or disorder, and you need to be under the care of a rheumatologist now. And so he did contact my primary care physician. I was put into rheumatology on an urgent order, and they started me on high doses of prednisone, and within hours, almost all of my pain was gone. And at that point, I decided to consult with Mayo, see if they would see me. They did see me. I was there last week. I think I had 29 visits in 3 days. On day one, they sent me to the lab. Oops. And 18 tubes of blood were drawn. I was ready for a couple of gallons of orange juice after that. That produced so far 21 test results. They're still coming in. And a whole host of other of other tests and appointments with specialists. I saw an internal medicine doctor first, who is my team captain there. He immediately did an ultrasound view of the aneurysm, which provoked substantial pain. He said, "That hurts, right?" And I said, "Yes, that hurts." And he said, "Well, that is your aneurysm. It is painful." I said, "Yes, I know. I've been saying that since 2020, and I was told it was GI pain." And he said, "That's not GI pain. That's aneurysm pain." I next went to a vascular surgeon who only works on complex aneurysms. That's what he does. He examined me, same course, palpated the aneurysm. He said, "That is clearly provoking pain. Your body is reacting to the pain, in addition to your brain reacting to it. Your body is reacting to it, so it's clearly painful. Aneurysms are not supposed to hurt. When they do hurt, that means we need to do something. Your aneurysm was inflamed in December. The prednisone is working. I see no signs of inflammation on your angiogram today. Nonetheless, inflammation or not, with the kind of pain that you've been having, I would have operated on this in December." He went on to talk about aneurysm pain and the difference in nerves. And I'm not a doctor. I don't play one on TV. I don't play one on YouTube. All I can do is relate what I've been told. And so what I was told was that there are nerves in the abdomen and pelvis, and I think they called them visceral nerves. And they are a little bit different than the other types of nerves that we have in our body. So if you bump your shin, your left shin, the nerves are specific enough that your brain knows that you bumped your left shin. With these visceral nerves, as I understand it, they're not that specific. So your brain knows that there's some kind of pain trigger in your abdomen or pelvis, but your brain really can't isolate exactly where that's coming from. And part of that is, the types of nerves, but also how the nerves get bundled together when they go into the spine and up to the brain. So he said, we can't always, look at aneurysm pain and say, okay, this is triggering pain of that nerve. He said, we can't get that specific. What we do know is that when an aneurysm is painful, it can cause all sorts of crazy, unexplainable pain that we can't quantify or that we can't isolate to a specific area. And that sometimes is hard for doctors to grasp. But what the funny thing is that when we repair the aneurysm, that crazy, unexplainable pain goes away. So, despite the fact that I couldn't give you a very specific reason or a very specific nerve that was causing the painful response, I can tell you that your aneurysm was causing that pain. And he said, you have some degenerative arthritis in your back, you're going to have some back pain. You know that. And I said, yes, I know that. He said, that's not what's going on here. You are having pain that is very much related to the aneurysm in one way or another. And your aneurysm is 5.1 centimeters. You're almost 58 years old at that time. He said, you're going to hit 5.5 centimeters in your lifetime, very soon in your lifetime, at which point the surgery is going to be automatic. He said, there is absolutely no reason when you're symptomatic the way you have been, there is no reason to not operate on a 5.1 centimeter aneurysm and fix your problem. After a pause, I looked at him and I said, you know, up until last month, my primary care physician, who I happen to like, had never even palpated that painful area from my sternum down to my belly button. He had communicated with the vascular surgeon. The vascular surgeon had told him aneurysms don't hurt, and so his response to me was, aneurysms don't hurt, that's not your aneurysm. Despite everything that I could tell him about the pain matching the pulse in my last month, finally he did palpate my abdomen. He clearly felt this pulsatile mass, as it was described by everybody, including the local physicians who saw me in the hospital in December. Pulsatile mass, painful pulsatile mass. He clearly felt it. He put his fingers on each side of the aneurysm, and he said, yes, that is your aneurysm. That was the first time. Up until that, it had been totally dismissed. And I told the doctor at Mayo, I said, so this is not a cluster B personality problem. And he laughed and he said, if that's what you've been told, or if that's been the insinuation, all I can do is apologize. This pain is not depression pain. This pain will cause depression. But this pain is physical. This pain is your aneurysm. This pain is your aorta. So he will be repairing my aneurysm on March 31st at Mayo Clinic in Rochester. He went to great lengths to explain the risks associated with the procedure, which are very real. I won't go into detail, but they are very real and concerning. But I can't go on like this either. Now, here is an image. This is part of a CT angiogram. So this is basically, you're seeing the top part of my kidneys and the aorta up in the chest. And the aorta should look like this, all the way down to where it splits or bifurcates and becomes the iliac arteries. This is what it looks like in my abdomen. So it looks pretty angry. And he showed me that. And he asked me, do you not think that is producing some pain? He said, remember that there are all kinds of arteries coming off of that are pulling in all different directions. So, of course, you're going to have pain that we can't explain. Okay, so that's my story, and I'm sticking to it. I go back to Mayo this afternoon. I'll go back to Rochester this afternoon. I have some pre-ops tomorrow, then some biopsies of some other tissues in my lungs and chest. On Tuesday, trying to track down this inflammatory disorder that I have, and then I will be going back March 31st. To have the surgery done that should have been done, according to him, definitely in December, although the symptoms and the signs were clearly there in May of 2020, and although the aneurysm was in the 4.3 range at that point, again, given the fact that it was symptomatic, he said, is it a surgery that I would have strongly recommended based on size? No. But given the fact that it was symptomatic then, you would have been totally justified in wanting to have it repaired. And I would have had no reservation in repairing it. When aneurysms hurt, they need to be addressed. All of the doctors that I saw at Mayo Clinic last week took the time. They wanted to go back. They had looked at all my local records going back a couple of years, and they all asked me to go back to the beginning of that period and talk about everything that I had been through. And to a person, every single one of them said, there is no reason for any of us or any other specialist to even consider the fact that you have major depressive disorder and or PTSD, because the problems you have are physical. They are complex. They are a challenge. You know, you're seeing 9 different specialties, which means they are a challenge. But we're going to have this done by the time you leave here next week, and we'll know what's going on. You've been dealing with your own doctors for over 2 years, and you still only have partial answers. We're going to get you the answers you need. Wow. So, yeah, and to finish that thought, I think I did, but to finish the thought, what they said was your issues are physical. They are not mental. Your physical issues will affect your mental health, but your mental health is not causing the physical issues. That's an important lesson. And I really hope this video will get shared widely with other healthcare professionals, because I think it's way too easy for healthcare professionals, when they run into something that's difficult or something that's challenging to take the easy way out and assume, oh, this person has depression, therefore these other problems aren't real. And I think we deserve better than that. I know we deserve better than that. So I do think this video fits very much in with my motto, which is advocate. It's a verb. Advocate for healthcare. Advocate for yourself for healthcare. I should never have agreed to have the colonoscopy and EGD. There are lots of things I should never have agreed to have done just to placate the doctors who were blinded by my depression and took the easy way out. So I ask you, please don't do what I did. Please learn from my mistakes. You're going to be much better off in the long run. So I will be packing up here and heading to Rochester again in a few minutes. Thank you all so much for joining me, for sticking with me for 36 minutes. I am so sorry, but I hope that the comprehensiveness of what I presented here has been valuable, and I wish all of you better health care than I have received. And if there's ever anything I can do to help anybody advocate for themselves, please reach out. Reach out. I've learned. I'm here. I'll help. Thanks for joining me. Until I see you the next time, stay happy, stay healthy. Take care. Goodbye.